So it's a biopsychosocial approach to be used. Okay.
Thank you. Yeah, and this is like another. Oh, sorry. Go ahead, Carl.
No, go ahead, Suleiman.
Yeah, I was just gonna kind of echo what Carl said about using some of the information that's out there and what's been done by SAMHSA. So essentially, what we really have done is that first step here is done some of the assessment, gathering some local data, and kind of we've kind of provided this here for the council to look forward to in terms of how to do next steps in terms of interpreting this information, and how to eventually get towards planning and implementation, and evaluation. And so really, the work that we've done represents that first step in the journey, and it obviously was a big step, and kind of, as Carl mentioned, one that was a novel step for the council. And so we hope that this will kind of just be something that you guys can build on and be able to make some evidence-based decision making going forward in terms of how to address different mental health and substance abuse issues in town.
This slide right here is the core of what a prevention council needs to know. It's how you decide what you're going to do in the years ahead. You need, and this is what we did, the assessment. What do we have? What do we need? And that's how you know what the capacity in your community is and do your planning based on that. So you know what you need to implement, and then you evaluate what you've implemented and start all over again. So it's a continuous quality improvement process that I know you all know in all variety of different settings. This is the one for mental health and substance abuse. It's called the Strategic Prevention Framework, the QI process for mental health.
Awesome. So kind of the flow. So kind of Carl gave those beginning remarks. I'm going to start off by going over some of the background data. So this is data that exists already that we kind of look to kind of help give some context to the survey findings. And so essentially this is gathered from different data sources. And all the sources are listed there, and they're listed in a glossary. So we would really encourage you guys, on your own time, you can always look back and view these different data sources as they apply to your specific discipline. After I go over some of the background data, I'm going to get into some of the survey stuff and kind of go over the mental health findings. Brianna is going to jump in talking about the substance abuse findings, and then finish off with some recommendations that the council can take into consideration for discussion afterwards. So a lot of the background data came from a big data collection effort through CT Data Haven. And what's nice is that they basically did almost what we did in a certain fashion. It's probably like the closest thing to what we've done in terms of getting direct responses from residents within West Hartford. A lot of the data that we found initially was just kind of based upon Connecticut as a whole. There wasn't as much West Hartford specific data, so this was kind of the closest thing. And it basically was about, some of the responses from 186 random individuals. Kind of what you'll see is some of this data is disaggregated by these different social determinants of health, like gender, age, education, and income. We included those where we could. We didn't want to make this a little bit too cumbersome, but if you kind of look at that asterisk, when you look at the titles of different slides, if you want to know more and kind of wonder, hey, like, how does this apply to, me as being a person who works with the elderly or people who work with kids, you can do that further deep dive on your own time and kind of see that. And again, like, these are some of the social determinants of health on the right part of the slide that this data resource gets into. And it's something that, we weren't able to fully kind of cover in our key informant survey, but a lot of this important information is out there for West Hartford. So we just wanted to provide that for you guys for easy access. So just starting off, you can kind of see here that when we look at the rates of anxious feelings in West Hartford compared to Connecticut, pretty similar. Maybe you can kind of say, okay, like, with some trends here that maybe West Hartford has lower rates of anxious feelings compared to Connecticut. It's kind of important with interpreting this data that there hasn't been any specific statistical analysis. So these are really just trends. So obviously, you have to keep that in mind when we see any of these trends here. But we just wanted to kind of give you guys the basis of what has been done and what's about mental health and substance abuse in West Hartford. So kind of some trends that we can see from this table here is that females in West Hartford tended to have higher rates of anxious feelings compared to males. Being under 55 also was associated with, having, more anxious feelings, or showed a trend of more anxious feelings. This same kind of trend was seen for people who were lower income, who had a college or less degree compared to a bachelor's or higher, and probably not unsurprisingly having kids. It was kind of like showed a trend of having, more reported anxious feelings. And so if you kind of continue on and look at how anxious feelings compares with things that are more indicative of depression, like feeling down or depressed, we see that, it's more common for people to be reporting, feelings of anxiety versus depression. And this is actually something that was consistent with some other data that we're going to talk about a little bit later on. So continuing on, we also can make some comments about substance abuse, specifically talking about smoking and also vaping. I know vaping is something that's come up a number of times in this council. And so this current smoking rate is basically a metric that combines the two graphs on the left and is basically kind of a crude rate of the current smoking rates. And so we see West Hartford has lower rates compared to Connecticut overall. And a similar finding, we see that with vaping as well. Okay. Other things that we can also comment on is binge drinking. And so we see here, if the graph all the way on the table all the way on the left, is a trend of having lower rates of binge drinking in West Hartford, lower rates of cannabis use in West Hartford as well, and also lower rates of opioid use all the way on the right side of the screen. What this third graph, or sorry, this third table from the left is commenting on prescription, drugs, and that's actually going to come up later in our report, finding that prescription drugs were something that the key informants mentioned as being a priority in our community. And we can see that basically the rates of prescription drug, misuse were similar from Connecticut compared to West Hartford. And so, what we found is actually a little consistent with some of the data that was reported just recently. So that's a nice way to kind of see that what we did kind of was correlating with what some other studies have shown. So I'm just going to skip the slide. So kind of continue on a little bit. This is more just aggregate data, so not necessarily broken down into those metrics that you saw prior, but again, a trend of generally having lower rates of anxiety, depression, and smoking in Connecticut compared to West Hartford. And the greater Hartford inner-ring is essentially a lot of the towns surrounding Hartford. That includes West Hartford, includes some Simsbury, other towns like that. So we're seeing that generally, West Hartford is doing better in some of these metrics, but obviously we know that any rate of depression, anxiety needs to be addressed, and so that's definitely at least having a baseline helps us to see whether or not these trends change from year to year. Some things that CT Data Haven didn't address were social isolation and stress, which definitely came up in our report. So we're glad that's something that we have added. Other things like psychotic disorders and personality disorders were not, necessarily commented on in the CT Data Haven data, and that's something that we did also, address as well. And finally, so with the CT Data Haven data, there was no comment specifically, for West Hartford in terms of opioid use. And so using another data source, CT Open Data, I was able to kind of do a tally and show that basically from 2012 to 2018, there were 44 reported accidental opioid-related drug deaths, or accidental drug-related deaths reported in West Hartford. 20 of those relating to opioid use. This is probably or most likely a undermeasurement of that, just because there's definitely a number of people who they don't have the demographic information on, who suffer from accidental drug-related deaths. So again, these are just some sources out there that, as you guys are doing your analysis, you guys can always look back at these data sources and see how these things change from year to year. One thing that CT Data Haven did have was some information on the rates of hospitalization in ED use, and specifically for two mental health disorders and substance abuse in general. And again, similar trend with West Hartford having lower rates. If we continue on to the next slide, we'll see essentially what this slide shows is how these adjusted rates of hospitalization for depressive disorder and substance abuse have changed from essentially 2013 to 2016. And the arrows moving to the right show kind of a worsening or an increase in the rates of utilization, which, again, if you need to be hospitalized for that, then it may not necessarily be a bad thing, but it does show kind of a greater need for these services and an increase in the use of these services. And we see kind of West Hartford being towards the lower end, obviously having lower numbers compared to Connecticut as a whole, compared to Greater Hartford, Hartford as a whole, compared to Greater Hartford Inner Ring as a whole. So again, West Hartford doing better than some of the surrounding towns, but obviously this trend of increased use in these services for depressive disorder and substance use disorder, compared to for instance, Rocky Hill was a town where they saw a decrease in that over the past couple years. And finally, just commenting on this just a little bit more, we see here that these are essentially the rates of mental health treatment admissions over the past couple years in West Hartford compared to Connecticut. And we can see basically for mental health, there hasn't been a significant change in that rate. There's been a gradual increase over the years from now on, back until 2010. And essentially, this is the rate per 10,000 on the top. And at the bottom kind of shows the gross numbers, so the crude numbers. So essentially 385 mental health treatment admissions in 2018. When we look at substance abuse, we do see that there's kind of some variation, but an overall decrease. And it's just kind of something that we had noted that some of the information that we were looking at in order to do some of our background information was kind of heavily substance abuse based, and not as much focus had been on mental health. And so that's something that we hope we had to address in our presentation in our study, seeing that there hasn't been much of a change in mental health, and an overall increase, whereas there's been some more variation and an overall decrease when it came to substance abuse. So now I'm just going to be going over the first part of the summary data from our survey. And I'll go over some background, then do the mental health stuff, and then Brianna will jump in with substance abuse. So kind of what Carl said, that we tried to use some validated tools and things that have been done in Connecticut in years prior to kind of give some weight to what we're doing and also help with the reproducibility.
I wanted to say that I don't know what point it was. I think it maybe been October or sometime. I sent around 6 big packets of information for people to look at. This is some of that information: the community readiness survey, the state epidemiological work group stuff, a lot of that stuff. That was a lot of the reference material that we all looked at. So that was a big foundational piece of this that you folks, if you looked at that at all, may have some of that. The other thing that we're going to come up to is there were 37 questions. We did an artificial thing and tried to summarize them into the top 10. It kind of worked because of how the content and gist of the questions. So you'll see that. The detail about the individual questions is all of the individual ones are in the back too. So depending on what your area of interest is, you can go to the individual question and see the summary and what the responses were. But it's sort of an executive summary in a way. So you'll see the top 10 and what the summaries are, because we wanted to formulate some kind of recommendations for this group to look at.
Okay, yeah, thank you for that addition, Carl. Yeah, and so one of those main resources that he mentioned was the community readiness survey, which I would say our survey is heavily based upon in some of the mental health and substance questions that we've asked. Particularly, the survey was kind of slanted towards youth, and it was more focused on substance abuse. And so, maybe kind of our survey would have some of that slant as well, and we basically had to adapt it to mental health. And then we did some of the qualitative open-ended stuff. We got that from the North River Community Needs Assessment. So, at least with the community readiness survey, that's something that has been done with a partnership through DMIS and CPES. And that's something that potentially could, continue on throughout the year. So that's something that the council could look towards and kind of see how those rates change, over the years and how that relates to West Hartford. So essentially, we did a data collection effort and administered the survey through Qualtrics, which is an online survey a tool that we use, and that's something that we had free access to the school. But obviously, if you guys felt the need to continue this type of work, something that you guys could get a subscription for. We used essentially kind of snowball sampling, asking people to send the survey along to their colleagues in order to help with the response rate. One thing that we did notice, our survey was fairly long, and so important when interpreting some of the data that you're going to see. The response rates kind of vary from sometimes it was 10 people who ended up, maybe finishing the whole survey versus like 57 respondents. So there's a lot of attrition. So that should be kind of fairly clear. With if you look under the far right of the slides, it'll show a count, and that'll essentially show how many people each of the responses, equate to. And so obviously that's important to keep in mind. Maybe 57 respondents versus 10 respondents carrying different weight. Another important thing to consider when interpreting some of the data, some of the questions were asking people to rank things in priority, which meant that when they rank something as being a high priority, it being 1, it has a lower mean, a lower value, which indicates it as being a higher priority. So we're going to designate that on the slide and make that clear. But that's different from some of the ones that are about agreement, where a higher mean indicates stronger agreement. And so just things to keep in mind when you're interpreting the slides. And we've tried to kind of put these designations there so you guys can see that and follow along. Importantly, what Carl said as well, the survey has been condensed, and we essentially just are giving you some of those top 10 findings like he mentioned. A complete report of the findings can be found in the glossary. There's also a data summary as well that it is a little bit more expanded from what we have here. There's also an Excel sheet that has all the data there if people want to do secondary data analysis to determine significance. So all that information is out there, and that's stuff that we've on to, I believe it was Andrea Ruggiero, should have all that information in a zip file. So if there's ever a desire, if you guys ever have a statistician that works with the town in the future, that's something that you guys could do some further data analysis to kind of help make sense of the information. So starting us off. So some comments about the demographics and who filled out the survey. The respondents were majority white Caucasian, female, and older. But essentially what we did find is that we had a diverse kind of professional background who were involved, and you can kind of see the different agencies and organizations that were represented. You see kind of at the top there's just, a big other category. And essentially a lot of that category was comprised of people who reported being seniors or older persons, and people who were part of like a senior center, also people stating that they were part of a nonprofit or community organization. And so I think that's one of the strong benefits of the survey is that, although maybe, the respondents were similar in some demographics, they really did represent a really diverse professional background. When we asked about, what were some areas that were most underserved by mental health and substance abuse resources in West Hartford, the majority of people mentioned Kennedy Park and New Park as 2 areas of interest, which obviously you guys can, if that is maybe familiar to you or something that's new news, that's something that was reported in the survey. We did give an option for other, and common responses that people talked about that were left out from the initial choices here were Elmwood and Hillcrest, identified as areas that also needed extra resources that were not represented in the list that we provided. So this is kind of the main first finding, specifically talking about mental health. And when asking what was the greatest mental health concern in the community overall, depression was the greatest concern that was reported, followed by anxiety. And when you look on the right, this is basically that similar question asked for each age cohort. And we can see that it's kind of pretty similar, anxiety, depression coming up. Anxiety, when you break it down from person to person, for some reason, people, more identified anxiety as the major issue, per age cohort. But so there's kind of like a difference between that and maybe as a whole. So that's something to consider, why that would be. But social isolation was something that was unique and specific to older adults. And obviously something that's important to keep in mind for those invested in the senior center and who do work with the senior population as well. So this slide talks a little bit more about some community mental health concerns. So things that we thought as a whole were either helpful or hindering community mental health understanding and efforts. And what's important here is that some of this data is actually very similar to what was reported for substance abuse. And so we did try to want to tease out some things, maybe some nuances that existed between mental health and substance abuse. But we actually found some very similar patterns. So as you kind of see this slide, if you can keep it in mind, it'll be actually very similar to what was reported for the community views on substance abuse concerns. And so obviously, the youth, overall was identified as having an increased risk for mental health issues. And that's definitely something that we saw a huge youth emphasis in some of the responses of the survey. And obviously, I mentioned that the survey does kind of have a bent towards the youth, but that's something that definitely was identified as a community concern. Um, the need for better promotion of programs, increased awareness, that was something that came up as well. So as you can see, the box at the bottom, it basically shows that there's kind of low agreement that people in the community know about the programs that exist, for preventing mental health. And so obviously with the advent of the Mental Health Awareness Week, that's something that, we're obviously actively doing in the month of May. And, there may need to be a further emphasis on that in the future, since that's an issue that people don't necessarily know what's going on in regards to mental health prevention. So we also asked, some feedback on some of the strategies, hopefully just to give some evidence on things that the council could do that's kind of backed by community support or shared kind of agreement. And, probably a little bit biased in having some of the members of the council share a coalition or council or task force to address these issues ranked as the highest potential community-based prevention strategy. And so obviously, hopefully that means that there'll be a lot of support for whatever things that the council puts forward in the community as well. Other things that were mentioned that would be helpful are media advocacy, as well as social marketing of mental health. And so this kind of goes with what I mentioned in the slide prior, how there's not an agreement about the awareness of these issues. And kind of one thing that we could do to fix that is do some better media outreach, do some better social marketing, really spread the word about mental health prevention efforts. Specifically, I'm speaking about the youth. They mentioned that youth were at an increased risk for mental health issues. In some ways to address that were through youth life social skills training programs, and also involving the parents. This is something that came up several times, even in the open-ended data. They need to help parents feel more equipped and more educated in how to deal with their children's mental health issues. And so that's something that we definitely are good. We're happy to see kind of come out really saliently through the findings. And also obviously involving the schools. And again, like the Mental Health Awareness Week that's coming up is a good example of that.
Excuse me, Suleiman, it occurs to me that we only have 20 minutes left for the meeting, and we're only on finding number 3. We got 7 more findings and the recommendations. So I'm not exactly sure what we're going to do about that.
I can, if you want, I can just kind of speed through these next ones.
I think that maybe that's the thing, and with just the understanding that there's a wealth of information here, and after this meeting, we're going to share this entire report with this council, and with the understanding that I thought that in the fall when we reconvene, this is the purpose of this, is for this council to look at this, think about it, think about the recommendations, see what you think about it, and come back with feedback about it, because this is just our thoughts about it. It's not the end all be all. Okay, sorry. Okay.
No problem. Yeah, I'll keep that in mind. And essentially just kind of screening and brief intervention was something that was mentioned to be important. And a lot of the data talked about the need for increased capacity. I mean, obviously this typically happens in the treatment setting. So increased capacity was something that could help address that. So some barriers that we addressed, very similar to the data in the past, insufficient awareness, lack of coordination, and limited resources. So those are some things that the council could look into to address. The barriers preventing mental health prevention efforts in West Hartford. Fortunately, lack of leadership was not identified as a barrier, listed on the bottom there. It's obviously the council is here and can have a major role in helping moving things along. Essentially, specifically about suicide prevention, most respondents said that there was some support in West Hartford, although maybe they were a little bit unaware of that happening in the community. Maybe them seeing suicide prevention trainings wasn't as common, or seeing any interventions done in the training was very uncommon. And most respondents felt kind of indifferent about West Hartford's suicide prevention efforts. So these last 2 slides about mental health essentially just kind of go over the specific unmet needs for each of these different cohorts listed in yellow. And this is something that I'll just kind of breeze over, and you guys can dive in more, kind of as Carl mentioned, on your own time. But essentially, 3 major things came out of asking these specific interventions for each cohort, the need for increased mental health staff training and capacity, the increased need for mental health education and coping skills, also addressing social isolation. And so kind of the numbers in parentheses kind of show how common that answer was for each different cohort. And in the bottom, we kind of see the different groups that we felt were left out of mental health prevention efforts. So racial ethnic minorities, seniors, and people with disabilities. So these are some different targeted interventions you guys could do in the future, meeting mental health needs for these groups. And this is some of the actual qualitative data that you can read on your own time. What is nice here that it just kind of gives some examples of some potential interventions. So if you guys had no clue about how to approach that, there is some of that in this qualitative data. Now I'm going to turn it over to Brianna now.
Hi everyone, I'm Brianna. I'm going to try to go through this as fast as possible to not take up too much time. So what I'm going to be talking about is the substance abuse portion of it. So for substance abuse, we saw that alcohol was the issue with the most concern, and that followed with prescription drug misuse, which mainly affected the adult and older population. And then obviously tobacco and cigarettes, as we see, follow after that. So am I able to click the next slide, Suleiman?
If you just want to say next, I can.
Okay, yeah, so you can go to the next one. So I'm just kind of go fast. So then we also saw with community views, we saw that the youth, regardless of the socioeconomic status, race, and ethnicity, they are at an increased risk for substance abuse issues. So that's something that can be targeted now that we do know that and we are aware that they are a higher risk. We can promote some recommendations, which we will at the end, that might be of assistance. We also saw that there was an increased need for an investment in alcohol and drug prevention programs throughout the town in West Hartford, and an increased need for awareness of community substance abuse programs in West Hartford as well. You can go to the next slide. So some prevention strategies that are more on the community-based side that we found would be like a coalition council task force that addressed substance abuse issues that were ranked the highest. So for example, we would target alcohol and prescription drug misuse as two of the higher issues to promote more recommendations for. And social marketing and mental health campaigns were the highest, the next highest, I should say. And then media advocacy to again then advance policy change and implement actual change with that as well. You can go to the next one. So again, with prevention strategies, and these are youth-based, we would promote youth life social skills training programs. That way, they can implement these skills young and early in their lives to help them out later. Parent education is always good. We did see a large response from parents, so obviously it's a population that wants to be involved in their children's lives. So that would be a good option. And then school-based mental health awareness, which I know you guys are trying to work on some mental health strategies right now for the month of May. So treatment-based, we see that screening and brief intervention for substance abuse treatment problems would be a good option, as well as adolescent substance abuse treatment services. So it's really important to really broaden the horizons and make it for all ages and populations. And then some barriers that we saw were insufficient awareness of current efforts that are already implemented or maybe in the works, a lack of coordination among organizations, and lack of programs with culturally competent staff. So cultural barriers were kind of a big issue within this survey that we did see, and we do have some recommendations at the end to really tailor to that need. And then we also have the lack of strategic plan to address substance abuse prevention needs. So kind of like Suleiman said, this is just kind of a brief overview of the substance abuse portion of it, of the unmet needs. So it is broken down into different populations and age groups. So I will let you guys dissect that at a later time. And then again, this is just more of the unmet needs and just some opportunities that are there for change. So this is just a quick little quote from respondents' description. West Hartford recognizes mental health and substance abuse problems, and leaders on the issue are identifiable, but little planning has been done to address problems and risk factors. So again, just promotion of programs or any interventions would be a really great idea, just so people know what's available for them. And then our recommendations, so the substance abuse portion of it, we think that education is a key recommendation for all populations in West Hartford. Each age group should be educated on not changing dosage or regimen of any medication that they are taking without talking to their doctor who prescribed it to them first. Never using another person's prescription and never giving their prescription to anyone else. And then also how to properly dispose of medications if they are no longer using it. A possible program to implement, I do know Carl let me know that you guys already do have prescription drug drop-off boxes, but I think it would be a good idea, and we think it would be a great idea to implement more and put it in different areas of West Hartford so everybody is included in that and they can easily access it. And go to the next one. So this is tailored to suicidality. So we think that access to mental health services such as therapy, and that's regardless of any insurance coverage or income, should be provided. Services should be made available for every age and socioeconomic background. So every resident of West Hartford is included. And then we also wanted to really push that it's important to be aware of cultural and faith-based practices and services. That way we can also cater to that population as well. Services should be promoted and marketed better, like we previously stated, so people know how they can access them, where to go, just different things like that. And we also think it would be useful to implement an at-risk oriented detection and interventions for clinical practices. And just kind of to go off of that, we think that a website might be useful if it was created to really pay attention to different prevention methods and options for those who are under stress and who might not even have anybody to talk to or see professionally. So for alcohol, we also suggested that education would be great for each age group. For young adults and adults, we would like to recommend education on the risk factors and the various health issues that can occur from drinking too much alcohol, because it's really great to get them while they're young and to prevent any usage or overusage of alcohol while we can prevent it from getting any worse than it already might be. AA meetings should be promoted with more locations and times so people are aware of when and where they can attend a meeting. And then a virtual portal for people to discuss alcohol intake or questions that they might have in regard to the effects from alcohol would also be a good option for the town to address it throughout the lifespan. I believe this is our last recommendation slide, and it focuses on cultural barriers. So they were identified throughout this project, and in order to address some of those barriers, we need to address access and perception. So we would like to promote greater access to culturally sensitive and diverse appropriate therapeutic services. And opportunities to improve these do include setting up a good line of communication with patients and providers, work with offices to promote a more culturally appropriate approach to care and health services, and also accessibility opportunities can include services throughout West Hartford, such as mental health facilities, substance abuse rehabilitation services, and also more attention to targeted populations examined within the survey. So for different issues like alcohol, we would target younger adults or adolescents, and prescription abuse, we would target adults to the older population. And we would also like to consider the role of telehealth in addressing gaps to receiving care. And this is just our glossary. Yeah, you go ahead, Suleiman.
Yeah, so say also with the glossary here, essentially all these are hyperlinks. And when you guys get the PowerPoint or the PDF, you guys can click through all of these different links here. Some of the data sources for the background on your left and the top. The survey design materials are here. You can look at those. We also have like the template, the summary data sheet, which is the last bullet point for the key informant survey. Probably might be a good place to start because that kind of helps pare everything down in a really succinct way. If you want a more expanded understanding of the data, you can just click on survey data that has that. The Excel sheet has the raw data for analysis. And the template essentially is there as well if you ever wanted to print that out and you try to re-administer that at any time, it's there as well. So, and we also included, kind of like Carl mentioned, the wellness guide that kind of can help really do some of the planning and the actual activity with what's been discussed here is there, as well as the strategic prevention framework. And so we've tried to just give you guys a lot of the resources that we use, and that might be helpful to kind of put some of those prevention efforts in place.
Okay. Well, thank you, Suleiman. Thank you, Brianna. That's a huge amount of information for folks to take in, I know. So I don't think there's much more to say about that. It's been a huge effort, and thank you again, Suleiman and Brianna.
Carl, this is Helen Rubino Turco. I also, and I know Astrid and Jackie will want to chime in, just really want to thank Brianna and Suleiman for their time, and also for Carl for overseeing them and shepherding this project. As Carl said, this is just the first stage, and we look forward to augmenting this report with other research by other of our partner organizations and also partner departments to flesh out particularly the wellness part. But you guys did just so terrific, the yeoman's work there, gathering that information and plumbing the depths of all those data sources. So we really appreciate your time. Thank you.
Okay, I guess we'll move on to LPC grant activities update.
Good evening, everyone. This is Jacqueline Zia Edgar, Town of West Hartford social worker and staff liaison for the council. I'll provide a little update on all the funded activities, and I'll go as fast as I can. The first activity is the virtual vaping awareness presentation. It's called Seeing Through the Vapors. Those web pages are up. They are advertised on our Facebook page. I think there might be a link also on the Town of West Hartford Social Services page. There is web pages for parents to view the workshop that's tailor-made for them. Middle school students have their own web page, and high school students have their own. We will be able to tally the number of visits and views that each web page gets. And this activity was for the total cost of $1,500. So that's been paid and it's up and active. Let's see, the next activity, we purchased Stop the Vape wristbands, which also feature the website for vaping resources for teens. The total cost for the wristbands were $790. These wristbands have been divided and will be distributed by our great partners and members of the Community Concern organization, and they will be distributed at Hall and Conard High Schools. We were able to make a $500 contribution to the Herring Project. So we were very, very happy about that. Also, in our next council meeting, we will have Ms. Tricia Dahl from the Yale School of Medicine. She's endorsed by the Connecticut Clearinghouse as a vaping awareness presenter. She will be presenting her information, and the title of her presentation is What You Need to Know About Youth Vaping, Prevention, Initiation, and Intervention. So this will be for our next meeting. Also, we have contracted with the West Hartford Community Interactive, our local media center for West Hartford, on 3 different events. The first one is a PSA challenge about vaping. It's a contest. It's been posted on the, I believe, on the West Hartford Community Interactive site and in other various websites. And it's just a contest for the community, West Hartford community, to get involved in and submit a, I believe it's a 30-second PSA on vaping awareness and prevention. The second event that we will be having is a mini documentary with participation from various community members. So that is in the works as well. And we also have a virtual panel discussion on vaping, which Dr. Karush Parham has accepted to participate. As you all know, he is the head of the UCONN Department of Head and Neck Surgery. We also may have a representative from the Parents Against Vaping organization. Not too sure about that, but we will have parent representation. We will have an individual also who has had real life experience with vaping. And when you tally all of these things together, we are very close to spending the total amount of the grant, which is $7,141.55. As a matter of fact, we may have $1.55 left over, but we're very close to it. And that concludes my presentation, but please feel free to add anything, Astrid, that I may have missed. Thank you.
Thank you, Jackie. That's an extraordinary number of things that came together.
I just wanted, this is Astrid Calderon, clinical social worker and manager of social services. I just wanted to thank you for all the work that have been done behind the curtains, especially for both of you that have presented this community assessment. We have been asking for this for so many years, as well as strategic planning. We didn't have the resources to do that. And we are very fortunate to have that. That will guide very much and very close the work that it's done by the social workers in our community, who are the main pillar of this work, and also that have been supporting this council for so many years. But one of the main thing is the need of a coalition, like Carl mentioned, in order to continue to have this type of actions, like doing a community assessment, doing so many activities. We met with the staff from Amplify and Can Plower, have accepted to meet with us to form a coalition. So we will be working during the summer to have a coalition done. So when we are back in September, we are ready to have another wheel of a group that is ready to continue with the recommendations that you guys have put together. So I wanted to thank you on behalf of all of the social workers that work in town, and my team and Jackie and all of you. Thank you for the great work.
That's great news. Thank you.
Yeah, thank you guys for letting us crash the party. This is Solomon.
This is Helen Rubino Turco. I also wanted to say that the mayor delivered a proclamation at the town council meeting on Tuesday evening, announcing celebrating National Prevention Week and also National Mental Health Month, particularly during this time when our community and our country are absorbing the psychological and emotional toll of this global pandemic. That we really, I'll just read this one little part, that we see and support activities to promote community wellness, including programs organized by town entities, school groups, and community partners. And she went on to list many of the community partners, and including the West Hartford Prevention Council and the work that you do. But the work that Jackie has been able to pull together, and Astrid with WHCTV, I'm sorry, West Hartford Community Interactive, just go on their website. It's the link is there to do the PSA or the documentary work. It's really, really cool stuff. And I want to applaud my team for thinking creatively about seeking these partners in our community to get some of these projects moved forward. Thank you.
Thank you, Helen. Okay, one item of new business, a list of trauma specialized mental health providers. Who had brought that?
This is Helen Rubino Turco. This group, a year or so ago, had talked about the importance of gathering information about resources in our community so that we had those at our fingertips in case of emergency, but not, that we should do that work when you're not in an emergency.
Yeah.
And certainly the Bridge Family Center, I see we have Chris Sutton as well as John on the meeting today, as well as our public schools and our social workers all have access and all have lists of people that they use. But it would be great to just make sure that those lists were combined or compared or updated, and that conversation about trauma specialists in our community was readily available. And the planning is everything, right? If you have those.
Didn't we have someone who said that they were going to take charge of
We
that?
did. So one of our members said so. I don't see her still on the line, but Kadzo was one who offered to assist or be on a if there was a group of people that wanted to look into this.
Okay,
Yeah.
well, we'll follow up because she left at 6 o'clock.
Yes.
Okay. Public comment?
I see no callers other than we do have some guests. So I didn't know if any of our guests wanted to take any.
You keep fading out your voice.
I'm sorry, I don't see any callers, but I did want to invite any of our guests if they had any questions to speak. And I don't hear anyone, so
Okay.
we have no comment.
Well, then I'm going to recommend adjournment. I would like a second for that.
Bob Mack, I will second.
Okay. And how do you vote, Howard?
I vote to adjourn.
And Brenda?
I vote to adjourn as well.
Jonathan?
Vote to adjourn.
And Nordia?
Again, great work, graduate students. When you're building the coalition, just think of cultural diversity, as many people you can add on to that. And I adjourn, vote to adjourn.
Okay, and Patricia?
Adjourn.
Thank
I
you
vote
all
to
for your
adjourn.
attention. Thank you all for your attention tonight. I know it was a huge amount of information to get through. So thank you. And we'll forward it all to you to have time to look it over in greater detail. But thank you for your attention. And thank you again, Suleiman and Brianna. I'll be taking you to dinner next week, by the way.
Great job, Suleiman and Brianna. Thank you again.
Congratulations to
Excellent-
them,
excellent
Brianna.
work.
Bye-bye.
Bye-bye.
Yeah, thank you guys.
Thank you.